Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is the basics of platelet rich plasma therapy. PRP is a very exciting procedure. It uses one's own growth factors, platelets, and stem cells to regenerate damaged tissue. Previously, it's been used for a long time in dentistry, urology, ophthalmology, and other fields of medicine, and recently it's become very popular in the musculoskeletal realm. It's a volume of plasma that has a platelet count above the baseline of whole blood. That's the actual definition. Regenerative medicine breaks the mold of conventional treatments. Cortisone, which is a gold standard in pain management, works extremely well, but it doesn't fix anything. It doesn't regenerate any tissue. So traditional treatments offer the good old proverbial Band-Aid, whereas regenerative treatments actually help to heal the actual problem. So the indications for PRP, which is short for the platelet rich plasma therapy, are broad. They include tennis elbow, golfer's elbow, rotator cuff tears or tendonitis, Achilles tendonitis, knee tendonitis, arthritis, pretty much in any joint, the hip, knee, shoulder, etc., and then ligament injuries. Athletes are using PRP like crazy in increasing numbers. Rafael Nadal, Tiger Woods, Kobe Bryant has used it, several of the LA Dodgers. Another example would be Hines Ward. Before the Super Bowl years ago, he had an MCL injury and used PRP and was able to participate in the Super Bowl. How is it performed? Well, initially it's just a simple blood draw, 30 to 60 cc's from the arm. Very simple. It's put into a test tube and then into a centrifuge machine and spun very rapidly for 8 to 15 minutes. That develops 3 layers, okay? The top is platelet plur. The middle is what you want, platelet-rich plasma, and the bottom is simply red blood cells. So this layer is taken out and used and injected into the problem area. PRP therapy actually promotes inflammation. This is the first part of healing. Therefore, anti-inflammatory should be ceased prior to treatment. Professional sports leagues have not banned the use of PRP therapy. Initially, the World Anti-Doping Association did ban it, but as of years ago, they accepted it due to lack of any current evidence concerning the use of these methods for purposes of performance enhancement. With regards to the outcomes of PRP therapy, there have been several studies. In the Clinical Journal of Sports Medicine, there was a knee study that looked at 22 patients. It showed that there was no change in arthritis in over 80% at 1 year, and this was just with one injection. Pain scores significantly decreased, whereas the functional and clinical scores increased at both 6 months and a year from the baseline. Basic science studies showed that PRP treatment may improve healing in many tissues. We don't have large clinical studies as of yet. There was also a study out of South Florida that looked at PRP for tennis elbow in 30 patients. All these patients had tried everything. They were basically looking at surgery. Over 90% of them were able to avoid the need for an operation. More studies are needed to prove the effectiveness of PRP treatment and to research the best ways to standardize the treatment's preparation. Risk-benefit ratio, it's your own blood, right? So there's no risk there. It's an outpatient procedure. You do cause increased pain for 48 hours, and that's because it sparks up inflammation to initiate the healing process. Series of 2 to 3 injections. It's not covered by insurance. The studies that show excellent outcomes, there is a slight downside, which we just discussed. There's a minor risk of infection. The top non-operative pain management is with the Washington Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. Average success rates exceed 90% with the board-certified award-winning providers. PRP therapy is currently not covered by insurance, but it is within the realm of most people's reach, especially for the benefits that it offers. Visit us online at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.